today. But again, welcome. I'm Julie Chronister. I am a faculty member in the Department of Counseling and more specifically in the clinical mental health counseling program. And I am the project director for this project. And I have my two colleagues on who are also working with me, and I'll let them introduce themselves.
Hi all, I'm Dr. O. I am also faculty in the counseling department and the coordinator of the MFT specialization, and have been working with Dr. Chronister and Dr. Streer on this project for, I guess we're almost done with our second year, or I don't know how time is working anymore. So yeah, but that's nice to see you all, excited to talk more about this project and how to get you all some money.
Hi, y'all. I'm Molly Streer, pronouns she, her, and I'm school counseling faculty in the department. And I'm the coordinator of the school counseling program as well. Thank you for being here.
Yeah, great. Please feel free as we go through this. If you have questions, you can ask during. We'll also have a Q&A at the end of this. And also there's the chat. And if for any reason you don't get things answered or you need more clarification, don't hesitate to reach out to myself or for any additional questions. So again, thanks for joining. The reason why we're having this meeting is that we have a training grant that offers students in their final year of their internship a stipend of $10,000. And with that stipend, they receive training in integrated behavioral health. And our particular project is titled the Equity and Justice Focused Integrated Behavioral Health Counselor Training Project. So I want to give just a broad overview of the project so you have a general sense of it. And Dr. Streer is going to talk a bit about the school-based integrated behavioral health sites. And Dr. O is going to talk about how to apply and all that business, and then any Q&A, and then we'll have, I'm not sure who all is going to be here, but we do have it seems to me we have at least 5 or 6 people joining to talk about their sites. So first and foremost, we do have a website, and I encourage you to look at that. You'll get a copy of this PowerPoint, and it will also be posted on our website, but we do have a website if you want to peruse that, and that's where the application will be and the webinars and everything you need to participate in the project. So big picture. The federal government has acknowledged that we do not have enough mental health, or more, the term we're using today is behavioral health providers in our community health centers. We have, and more particularly, they're very interested in getting more behavioral health providers in integrated care settings. And so they have they put out a grant to academic and other training institutions and said, hey, if you can train your students in integrated behavioral health and get them into sites that train in integrated care, we're happy to give you some money to do that. And so we received this grant in 2021. We're in year 2. And those of you who will be applying for this next year, meaning you'll be starting your second year or final year internship next fall of 2023. This is the project that you would be applying for. So the goals are really to increase the supply of counselors trained to work in integrated care settings, and more specifically with youth in integrated care settings, and what the funding source likes to term medically underserved communities or medically underserved populations. Those who are not receiving care, those from our communities of color, and those from linguistically diverse backgrounds. So those are like the priorities of the grant. Why integrated behavioral health? And you're going to learn about this in the project if you decide to apply and receive the award. But many of you may know this, but majority of people go see their primary care providers more often than mental health care providers. And a chunk of people have mental health conditions, but don't get care. One, because they're not going to go across town to a mental health provider. Two, the stigma. Three, access issues, and all kinds of barriers that prevent people who need mental health services from accessing them. And so this movement towards, hey, let's get everything under one roof, or at least in a more coordinated, collaborative structure, is really the intent of integrated care. And some of you may be doing some aspects of integrated care already, or team-based care, where you're working with other interprofessionals. But this project in particular is focused on getting you on-site training and also didactic training in integrated behavioral health care. So just a couple things. This grant in particular focuses on getting counselors and other behavioral health providers in primary care settings. Now, this is not to say that that is where you have to do your training. And in fact, we don't have enough primary care sites to take students, but we're working on that. But they do prioritize a primary care setting. And so I'm just showing you the definition from our funding source. And there are sites that meet the definition of primary care that aren't in a traditional primary care setting, but this is where they would like our students to be training. This is ideally the most integrated setting. They also would like you, these are priorities of the grant, that's why I'm putting them up here, to work in medically underserved communities. We also call these healthcare professional shortage areas. And many of you are working in these areas already, but we have a number of communities that lack adequate healthcare provision, as well as behavioral health care provision. And so these are also the terms that our funding source uses. And I put these up here because when you do apply and you do receive the stipend, there is some level of commitment agreement from you that you plan to, either see yourself working in a primary care setting, or a medically underserved community, or in an area that serves medically underserved populations, right? Also known as these shortage areas. Also, another priority of this grant is to work in a rural setting. And, obviously we are not situated in a rural area, but some of you may consider that in your future. So just important to know the priorities of the grant. So when you do think about this, that you think about, I think I could commit, or at least consider committing, working in a healthcare professional shortage area, in a primary care setting, working with underserved communities, working in a rural community, because these are truly the areas that need our help. And just to give you a broad overview, and today we will probably have some people on here who work in these settings. So one of the primary target settings that this grant focuses on, well, there's really two primary areas: our community health centers and then our school-based behavioral health settings. And Dr. Shapiro will talk about that. But one primary focus of this grant is getting our students into what we call community health centers, otherwise known as federally qualified health centers. And in the Bay Area, we have, let's see, these health centers are in high need areas. Everyone can access care there, no matter what they can pay or whether or not they have health insurance. And ideally, they provide a very comprehensive set of services. And there's also what they call a patient governing board. These are, I have a few up here. In SF, these are Health Right 360, Planned Parenthood, Native American Health Center, San Francisco Community Health Center. These are the community health centers or federally qualified health centers in San Francisco. And we will probably have a few of these on later to talk. So, these are particularly important areas for our students to be working in, and our funding source would really like to see our students getting trained in and working in these settings. 1 out of 12 people in the US rely on these settings for healthcare. We need to have mental health care under this roof because people aren't getting their mental health care needs met. Just a definition of FQHCs. Talked about that. Let's see, do I have time? Yeah, I'm gonna just play this video. It's they will be on later to talk about their setting, but I think this is a good depiction of our community health centers.
For over 30 years at San Francisco Community Health Center, we've been striving and we have been providing the most comprehensive continuum of care, not just for the HIV community, but for the LGBTQ community, the trans community, and most recently the homeless community. This is our goal, is to ensure that we have as comprehensive, as holistic, and whole person-centered care as possible.
Here at San Francisco Community Health Center, we treat the whole person. Our team complies behavioral health, dental, case management, outreach workers, the medical providers, of course, programs, even the people who cook the meals for our patients.
I think what makes San Francisco Community Health Center so magical is that there's really nothing like this anywhere else.
Our philosophy as an organization is that we never give up. We do whatever it takes to serve our clients in the most comprehensive, culturally competent manner possible.
From the minute that I walked into this clinic, I knew that it was different because of the sense of community that this clinic offers.
There is nowhere else that you can arrive and be greeted by somebody who looks like you or who has had a similar experience as you, who can connect you to a provider who's just going to be super responsive to your needs.
Being able to come in here without feeling any type of stigma, without feeling like I'm less than or ostracized or just being picked on for being who I was is the greatest reward.
20 years ago, when I came out as who I am, there were really no services available, and I was seeking services for myself. And when I landed here at San Francisco Community Health Center, I just kind of like opened a treasure chest where all of these services are available for me. And I want each and every one who comes through our door to experience that.
Our outreach team is grounded in the fact that our clients' needs are urgent.
My team works with some of the hardest to reach. The folks here in San Francisco in the Tenderloin that are suffering incredibly. And we do the most amazing job because I have a talented, skillful, compassionate, empathic team.
You know, imagine you're this person who lives outside in a tent, who has so much distrust in the medical system because you've been turned away, you know, time after time when you've tried to get help. And your things were stolen the night before, you haven't slept, you don't have any food, and someone from our team approaches you to try and give you something that you actually need and make you feel like your life is valued, because we actually bring our services to the folks that we serve out in the community on our outreach team.
Actually going and finding people and meeting them where they are and really taking the resources and knowledge and information that we have.
And we tell them that we'll be back tomorrow if you're not ready to come in yet. We remind them that their life matters.
There's a special sauce here at San Francisco Community Health Center. What we do together when we're here in our office is we celebrate, we laugh together, and we actually create a culture of joy.
Okay. So just a brief window into what our community health centers are doing. And they're, you know, these centers are often also considered centers that are working on the whole person, and integrated care. I think we actually have a student at this site this year, in fact. Oops. So again, these are the community health centers in San Francisco that we're really hoping to get our students in. And it's not that we are still building a pipeline with some of these, but we do have a training site connected with Lifelong. And this is Alameda County, sorry, Lifelong, La Clínica so far. Let's see. I'm not gonna play that one, but you can always play it. I will post this. So I'm just listing here some of the HRSA project training sites that those of you looking for a site that's very well aligned with this project for next year. These are a list of these sites, and they're also on our website as well. And so now I'm going to hand it over to, oh, also before I do that, sorry, I'm a little clunky today. We also are working with San Francisco Health Network, which has many clinics, some very integrated. And also they have teen clinics, children's clinics, adult clinics. Now we don't have placements at all of them, but we have placements with some of them. And I believe the woman who runs this is going to be joining us today as well. So that's another opportunity to get into a primary care setting to do your internship. And now I'm going to hand over this colorful slide to Dr. Streer.
Thank you, Dr. Chronister. If you're clunky today, then get ready for this, folks, because I definitely am too. Hi, everyone. So as mentioned by Dr. Chronister, one of the priorities of this grant is to increase integration and service access for youth. And we know, and a lot of the research suggests that young people are more likely to access services if they can do so through a school-based mental health provider. And so this slide is just an example of a lot of the important student service providers that go into an integrated care model when you're working in a school setting. So whether you are a school counseling student out there or an MFT, clinical mental health, but you have desire to work in a school setting, hopefully you're going to be collaborating with folks like the school nurse, community health outreach workers, occupational therapists, social workers, so on and so forth. And as many of our school districts in the Bay Area actually implement a sort of semi-integrated system in which we have wellness centers within our schools. And so if you want to go to the next slide, please. It's, I believe, kind of talking a little bit about the wellness initiative, I believe in San Francisco. So many schools in San Francisco, in the Bay Area rather, do have an integrated model. So we've got school counselors that are typically working through comprehensive school counseling programs with general education students. And then we are providing services, as those of you in that field know, through a multi-tiered system of supports model. And so school counselors are often providing services to all students, small group services, and some individual services as well. But because we have very big caseloads, we can't necessarily provide all of the individual needs necessary. And that is when we might tag in our wellness colleagues and provide referrals to wellness centers within our schools. And so this is a really important model. It's a good way for young people to access services, and hopefully and ideally you all can improve and increase the integration among these services, because even though sometimes these services exist within the same school, we're not always perfect in our integration and the way that we communicate. So the next slide provides just a couple of context folks for you. Certainly, as mentioned by Dr. Chronister, these lists are not extensive. And so Dr. O is going to talk a minute, next slide actually, in a minute, about the application process. But one of the things that will go into that is essentially, if you decide to do your field work in one of these placements that we sort of already identified, you've got to streamline position because we know that these folks are really aligned with this training program. But even if you are hoping to connect with somewhere, an integrated site providing services to the communities that have been identified through the priorities in a different area, if they're not listed here, that's okay. You're just going to kind of explain to us how it connects to the grant and the project. So even though this is kind of a short list, certainly know that you are not restricted to SFUSD, OUSD, or Jefferson Union. So one thing to make note of is for school counseling students, obviously you're going to be looking for school counseling field work. So your point of contact might look different. So if you are going to be an SFUSD, you might be connected to Ling Busche. If you're an OUSD, that would be Elizabeth Panagua, who's also one of our amazing adjunct faculty. And then if you are a clinical person, so if you are in the clinical mental health or MFT program, but you still want to be working in a school, you might be reaching out to the behavioral health field work folks in these districts and or other surrounding districts. So those are some of the language you might be looking for as you're reaching out to get context for future placements. Okay. And I will pass it to Dr. O to talk more specifically about what the application process looks like.
Hey, before I move on, I think I saw a hand up from, Eva?
Yeah, sorry, I had a quick question. So I guess I'm not necessarily school counseling specialization. I am college. And it just sounds to me like this is not necessarily geared towards that specialization, but I do work like in a high school, and we do work with like a wellness center, and like my office is right next to them, and like their work is very much close to what I do also as my role here at the high school. So would that also allow me to apply for this because of that, or do I specifically need to be in the school counseling specialization?
Yeah, I'm thinking maybe Dr. O, we'll cover that when you move forward, or maybe not, but no, you do not have to necessarily be, you can be in a college or career specialization. What we're really looking for is that you are in a training site that's as aligned as possible with our training grant. And the other thing that we're looking for college and career counselors is that they have an emphasis in clinical mental health counseling. So those are the two things that I think will position you for having a better chance at receiving the stipend in the training. But just so you know, even students who are, say, clinical mental health, who are in a site that's at all aligned with this project may not get the stipend. The majority of people who apply get it. There's always a few that don't fit the priorities. I think that's why we're doing this information meeting as far up front before you start looking for your site, because if you do want to get this training, we want to see that you have taken an internship. It may not be one that's on our list because there aren't enough. We have 29 stipends to give out. We don't have enough sites for all 29. However, we want to see students trying to get into these sites, or at least being in a site that has some degree of integration or working with youth. And please, Dr. O and Stuart, jump in on that if I'm missing anything.
Yeah, thank you. The only thing I would add is based on your description of the services that you're providing currently. And I hear that maybe that's your fieldwork now. So again, as Dr. Cronister mentioned, using this to kind of think about planning for next year and your placement for next year. But I will say, it sounds to me like you are providing post-secondary access services, college counseling services to youth. So in that regard, even though you are a college specialization, and I don't want to, please jump in if I'm speaking out of line here, but to me, it does sound like you are serving youth, right? Which is one of the, and one of the priorities of this grant is also transitional age youth. So if you are providing services for folks that are transitioning into adulthood, so, our older teens, early 20-year-olds, late adolescents, and you're definitely still providing services to communities that are targeted here in our priorities. So I would say it sounds like a good fit, but also keeping in mind that we're kind of thinking for next year, next field placement. So planning ahead. But it does sound like your current placement would meet those priorities as well.
And I also just want to emphasize that it is important that you have an emphasis in clinical mental health if you're not an MFT student. And I know that that might not land well with some of the college and career, but the priorities of the grant, they do want to see that the stipend recipient is pursuing a counselor licensure. We have to report on that. And we all feel kind of mixed about it. But the reality is it makes it really hard to report if you're not pursuing a licensure, right? So I would ask that if you are considering applying for this and you do not have an emphasis in clinical mental health, that you chat with me and see if that's a possibility for you. Did that help?
Yes, thank you so much, all of you.
Yeah, okay.
Yeah, and I think I'll just chime into what you all were sharing. Yeah, when we wrote the grant, we really were trying to include all specializations. And then as the federal government does, they were like, they want us to only be offering this to folks who, as Dr. Cronister said, are eligible for one of the licenses. And so that's where for college and career, the need to add the CMHC came in because it's what the federal government is asking of us to go back. And so, so how do we apply? What does it look like? What do you all have to do? We tried to make it as simple as possible. So really step one is you're here and you're learning about what internships make you the most eligible for it, right? And so hopefully your takeaway is the ideal is primary care, federally qualified health center, right? Like that's what HRSA really wants us to be doing. And so if you're in there, boom, in. Second easiest, one of our project pre-approve on our list, which you can see on our website. And when you go to apply, so that's step one, is just making sure you're getting an internship. And then from there, you're looking at medically underserved communities. Is it working with transitional age youth or youth? Is it working, are you providing services in another language, right? Like all of these things help. If you're not in one of those like really easy for us to approve ones, you're telling us how you are helping to solve this shortage of healthcare professionals in the ways that align with what the grant is asking for. So that's what you're looking at. And so in the spring, we have a Qualtrics form or like it's a really short, I should probably put that, it's like a one-pager that really asks you, I brought it up for myself to remember, your name, your specialization, and the internship agency where you got it, right? So those are the key things that you need. And then, what languages you can provide counseling in. And then we have, if you have one of our pre-approved lists, the only other question you have is, my internship is at one of these pre-approved places, and then you're done. That's the whole application. If you're not at one of those sites, then the next page asks you to tell us how is it helping you understand the specific concerns for children, adolescents, or transitional age youth, right? So how are you, and so it's not just transitional age youth, it's children, adolescents, right? So if you're in a school counselor, super easy to answer that question because you're working with kids. How is it increasing your knowledge and skill with interdisciplinary collaboration, which is a big thing that happens when you're in primary care settings? How is it preparing you for team-based integrative care? And then how does it help you meet the needs of these medically underserved communities that Dr. Cronister was outlining? So that's what the application is. It really is, if you're at one of the project approved sites, name, I'm at this site, done. If you're not at one of those sites, you just need to tell us how what you're doing helps, like, meets the expectations of this grant. And so then that way we can prioritize folks who apply based on those criteria, right? And so you'll send that in. And then we review it. Like Dr. Cronister said, we've got 29 of these to give away. And so we usually get to give out to a majority of folks who apply. Once you do that, you make sure you read through the student commitment form. And that's going to tell you what the expectations are. Really important takeaway, there isn't like a work payback. With a lot of grants like this, you have to commit to paying, working for 2 years. There's not one of those on this one. You do need to certify that you are intending to work in these communities, right? You're intending to work in communities that need this care, and you know, that sort of, but you don't have to. There's not like the tracking thing that we do where we're doing that. So there's not one of those that comes with it. So once we get all the applications in, we will send an email out to everyone letting them know who's gotten the award. Once you get that, there's that student commitment form that you'll sign via DocuSign. And then there will be another like stipend form. I think they're pictured on the next page. And then you'll get $10,000 in August of 2023. And then the thing that you'll have to do is make sure you attend, so that we don't ask for a payback, but you do have to attend 10 one-hour webinars throughout the course of next academic year. You don't have to attend them in real time. Some of them are pre-recorded, but you do have to watch them, and you complete a survey at the end saying what you learned. You write a couple of sentences about what you're taking away. So really you're getting, you know, so, and you have to successfully finish your internship, which you need to do for graduation anyways. So the real big additional thing that you're doing is attending these 10 webinars throughout the year. And we have a kickoff session that you'll come to at the beginning, just to get to know each other and do that. So those are the big things. I think maybe the next slide. So this is what the commitment form looks like. You'll see it's sort of a single page. It says what you need to do. And you can sort of see like you're committing to enrolling in a project approved internship. You're going to complete the training modules. You're going to complete your internship year. You commit to providing, you know, when Dr. Chronister reaches out, you're going to answer and provide, because she has to file this massive report every year with demographic information and data about who did the federal government give their money to. And importantly, because it is funded by the federal government, it's only open to citizens, national or permanent residents of the US. And so that's an important, unfortunate or fortunate thing to do. And then the other part, for those of you who are MFT or CMHC, right? If you're going for your LPCC or your LMFT, you're also going to need to apply for your National Provider Identifier number upon graduation. And you say that you're going to give that to us, which you need to do anyways once you start working. So pretty low ask. It's like stuff you're already doing basically, except for this additional training module. And then you'll also get, you can see that stipend appointment form. That's the really important form that you'll get via DocuSign, and that's how you get your money. So the other part is making sure that when, you know, really being responsive to emails from all of us related to these, because that's how you get paid. I think next slide. It's just a summary of what I've said. So yeah, these are the expectations. You know, attend the webinars, they're live or pre-recorded. The pre-recorded ones are up on our website. Complete your last year of internship. Make a verbal commitment to working with medically underserved communities and medically underserved populations, and then respond to Chronister's request for information pre and post grad. So I think that's it.
May I just jump in really fast? I just want to reiterate to the school folks out there, because I know sometimes when we get into the language of primary care, that I've actually had students in the past choose not to apply or participate because they just feel like it's not a great fit for our school counseling students. So I'm just here to plug and reiterate that for all of you school counseling students out there, school counseling fieldwork does count as well. That is a priority of this grant, is school-based services. So not to worry if you're wondering if we are still a good fit here.
Mm-hmm. Yeah, thank you both for that. I just have here a list, and please go to our website if you're curious about what the webinars are. This is a list that it's kind of a combination of what we're doing this year and some of the good ones we had last year. But as you can see, you know, our project is very much focused on, you know, not just integrated behavioral health, but an equity and justice focus. So they're really, for the most part, we have some really delicious webinars, in my humble opinion, some better than others, but really good webinars. And some would be already recorded that you could watch anytime. Some are live, but even if they're live, you can watch them recorded. So it's pretty student friendly. Okay. Well, questions? Q&A. Anybody have any questions? Let me just turn this off so we can see everybody.
Can I ask a quick question?
Of course.
So, I'm currently a first year student.
Mhm.
So for me, I would have to apply next year of fall, right?
Yeah, yeah.
What-
Are you doing an internship this year?
Yes, ma'am.
Oh, okay, right. So if you're gonna do your final year internship next fall, 2023, is that right? Yeah. Sorry, Peter, I see that's you talking. You would apply at the next round, which the application due date, which we have not named, is usually like mid-April, am I right? And that will get communicated for sure. So just to give you a big picture, this is kind of just giving you the big picture. Those of you who are doing your final year internship next year and are interested in this, should apply, and the application will be due in April. And, you know, we have a deadline, but we want to make sure everybody gets their application in. And I think what's important is that you secure your internship sooner than later. You know, I mean, most students get it in the spring, you know, but it's best if you have that secured when you apply. Does that help? Make sense? Sorry. So yes, we will communicate when the application is ready to submit and give a deadline.
Thank you.
Yeah. Anybody else have questions? No? Oh, Lana.
Sorry, I'm having a hard time with my connection. Hi, Dr. Cronister and everyone.
Hi.
Quick question. I had to come in a little bit late, but can you please remind us where we can find the approved list of sites?
Yeah, so the best place to get the list is on our website, and it's IBH Equity at SFS. Let me put it in the chat. We have a list on the, actually, I could probably open up the website. And I believe all of them, I'm sorry if this isn't the case, I think they're all on the master list, but something tells me they might not be. And so I need to make sure they get on there.
They are on the master list.
Are they all on there?
Yeah, Melissa was
Okay.
just messaging with us today. Although,
Oh.
you know, for some, it's not quite as clear, but like we just increased our partnership with the San Francisco Department of Public Health. And so all of those are there, but the master list, you know, the master list is a big spreadsheet, so it gets a little clunky, but yeah, all of they are on there. It's just harder. There's no thing that's on the master list that says this is a HRSA one. So you need to go to our website to see that.
Right. Does that help? And if anyone's having any confusion around sites, you know, master list, our website, and then confusion, just talk to us as well. Did that clarify, Lana?
Yes, thank you so much.
Yeah, no worries. Any other questions? So I see that Rita is here.
Hi.
Hi. And Rita is welcome. Rita, thank you for joining, and I will let you introduce yourself, but she's one of our partners and it oversees the San Francisco Health Network primary care settings, and is here to talk about her site. So if no more questions, I will hand it over to you. Does that sound okay?
Sounds great.
Yeah. Thank you so much for being here too.
Yeah, well, thank you for inviting me. My name is Rita Perez. I'm the primary care behavioral health manager. We are 14 primary care clinics in the San Francisco Health Network, which is part of the Department of Public Health. Of those 14 different primary care sites that we have potential internship sites at 11. The services range, well, I shouldn't say the services. Well, services, it's all primary care, one-stop shop. Each clinic has different things. Some clinics have food pharmacy, some have dental on site, some have acupuncture, podiatry. So it just depends on each clinic site, the different specializations that are located within them. But our internship opportunities offer you the opportunity to learn about biopsychosocial assessments, using standard screeners, learning brief intervention to target some of the commonly reasons for referral, which is around depression, anxiety, sleep disturbance, addressing acute health issues, some substance, some crisis work. And let's see, what else can I tell you? Each clinic that has, so I can tell you the name of the clinics that it's probably easier to get onto our website, or just give me a call. I'll talk to you more in particular about each clinic, because each clinic serves different populations. For example, Family Health Center is located on the ZFSG campus, and they provide services from 0 to the end of life. Another one of our clinics is Tom Waddell Urban Health Center. That's in the Tenderloin. They work only with adults. And they also offer an additional stipend for an intern that's accepted there. Dimensions Clinic, it's very specific, LGBTQ2, LGBT, and I'm just going to say plus because I'm going to mess up the rest of the letters. From starting, I believe, about 12 or 13 up to about 24 years old. And they also have an additional stipend. Balboa Teen Clinic, actually located on the Balboa High School campus. So there's a lot of work there with the Wellness Center. They are a part of the Wellness Center, a lot of work with the school counselors. So each clinic offers a little bit difference. There's a little bit of difference within each one, but it's all in the integrated behavioral health model, short-term, 1 to 10 sessions. The initial assessment being the longest one, that could be the full hour, potential for a second part of an assessment. And then after that, follow-up appointments can be anywhere from 30 minutes to 45 minutes.
I just popped this up to remind people, is this help or hurt your presentation?
Oh, that's perfect.
Yeah.
It gives people a visual for it.
Yeah.
So right now it's Family Health Center, Southeast Health Center, Children's Health Center, Tom Waddell Urban Health Center, Dimensions Clinic, Castro Mission Health Center, Richard Fines Clinic, Silver Avenue Family Health Center, Balboa Teen Health Center, Potrero Hill Health Center, and Chinatown Public Health Center. Those are the ones where there are potential sites. And it just depends too, in terms of the track that you're in school, because some of our, I know for students that are in the MFT program, you need somebody that's licensed. Some of our supervisors are licensed, others are not. But they are, they've had their MSW beyond, more than 2 years. Happy to answer any questions.
Yeah, thank you so much. And I'm so thrilled to hear how many options there are there. I mean, there's many sites. I mean, I think I heard you say 11 or 12 maybe sites.
11.
So, yeah. And also a reminder for clinical mental health students that are here is you don't actually, although I think it's good to have a license, but not, you don't need a licensed supervisor. I mean, you need someone who has some years supervising and being in this setting, but in any event, questions for Rita?
And I'm sure some will come up later. Feel free to reach out. Give me a day or two to respond to emails. I tend to be behind, but I do respond.
Yeah. Thank you so much. And we'll make sure everybody will have your contact information. And it sounds like you're comfortable with people reaching directly to you.
Absolutely.
That's
absolutely.
awesome. Thank you so much.
Yeah.
And we have more partners. This is just really great. I appreciate you all coming. Lance, welcome. Anya, welcome. Am I missing anyone? Evelyn. And
Michelle.
Michelle, thank you. Does anyone, Rita just shared about at her site. Would someone like to go next?
Sure, I can go. So just general information about my site.
Yeah.
Is that okay?
Yeah, for sure. And I'll let you know that we played the video for your agency earlier in the session in our
Oh, cool.
information meeting, which is
Oh,
great.
okay, great. Because I probably said it better than I could, I think, to give the visual. But my name's Lance Dwyer. I'm a licensed clinical social worker, and I work out of the San Francisco Community Health Center. We have two offices, one in the Tenderloin, one kind of the Castro market area. And then we're opening up a third next year, in January, February, mainly for the trans services. That'll be a few blocks away on Pine Street. So we're gonna have 3 offices soon. Oh, actually a 4th office in Chicago that mostly does capacity building. So 4 total offices next year. And yeah, we're a federally qualified health center. So we have a lot of comprehensive medical and behavioral health services here, case management. We consider ourselves like a full-fledged community center. So we have programs that serve folks living with HIV, as well as trans folks. And we have a youth program as well. So yes, we get referrals from the clinic. Anyone from any of the medical providers can refer to us, as well as our case managers from our various programs can refer to us. So yeah, we have a diversity of clients ranging from folks who qualify for Medi-Cal, who maybe have started a new business and have a master's degree, to folks who are chronically homeless, in recovery. That's just my caseload, for example, that the range that I have. So incredible diversity of clients. We tend to target and serve primarily LGBTQ, people of color, but pretty much serve anyone. Yeah, I think, was any other details other details to cover?
That sounds great. One thing I would ask, if there are students interested, should they contact you directly?
Sure.
You're the
Yeah.
Yeah, so I think your contact information is there, but I just want to make sure that that's the route to pursue in training, to contact you directly.
Yeah, I guess another thing folks tend to ask about is our team is really growing in terms of social workers and therapists, and so we offer a lot of training we have a current trainee, and so there's at least another group every week, whether it's like a consultation group or another social worker might offer a training on narrative therapy, for example, or trans competent care. So there's usually another group every week in addition to individual supervision. Sometimes there's 2 or 3 opportunities for training or group consultation.
Awesome. It sounds like you all are thriving. And any questions for Lance from students? Okay. And also, I should have told our partners, we are recording this, just so you know, because a lot of students can't always make the time. So this will be disseminated as well. So thank you, Lance.
Of course, happy to be here. Okay, take care, everybody.
Yeah, thank you.
Bye.
Anyone else want to jump in?
Go. Hi, everyone. My name is Anya Shapiro. I am the Executive Director at the Daly City Youth Health Center, and we also are a FQHC. So we do have primary care here at the center. We are also school linked with the Jefferson Union High School District, and we provide behavioral health services within our clinic. So it sort of resembles like a private practice. We also provide care on our various high school campuses, as well as at elementary and middle schools within the Pacifica area. So there is an option for you to sort of pick from a menu of things that interest you and create the kind of practicum experience that you want. So if you'd like working with littles, you can tell us you want to work at an elementary school. If you prefer teenagers, you can work at a high school. If you want to get a little bit of both, we can actually place you at a school and a clinic. Or if you're like, I just really want to go the private practice route, we can place you at the clinic only. I, however, would recommend that you do a little blend so that when you are, applying for work, you've tried all the different options and can be ready for a variety of different jobs. And you can also really decide if you like or don't like something. Like we've had people who didn't, were very averse to working with littles and were placed, just wanted to give it a try, and they decided they really loved it. So you'll never know. So it's good to give things a try during your practicum year. We have a really strong training component. It's quite challenging. So if you are looking to really learn a lot, and put some work in and be a little bit uncomfortable while you're learning, then we are the place for you. If you're looking for kind of an easy, sail by kind of practicum, we're probably not the place. But all of the hard work that you would put in with us is well rewarded with lots of learning. Our folks at the end of the year tell us that they feel really confident and comfortable, that they learned so much, and are really appreciative of the difference that they see in themselves. So one of our biggest learning components is we offer an intensive family systems training throughout the year, where we use a one-way mirror and you have a supervisor in your ear telling you what to say. I know that sounds terrifying at first, but actually it's quite lovely, because who doesn't want a supervisor in their ear telling them what to say whenever you feel stuck or confused or something, right? So this is a good thing to have happen. And you are learning in the moment, you're getting feedback in the moment. And your peers then become a reflecting team for the family that you bring in. And so everybody wins, everybody gets something out of it. It feels like kind of 6 months worth of work in one session for the family that you're working with. And all the brilliant things that come out of your mouth, they think are coming from you. So they can't tell when a supervisor is telling you to say something or not. They of course know that there's someone observing, but they don't know when you're getting a message. So the family that you're working with is feeling really secure and tends to really like working with you all. So that's a big training component of our program. We also do other topic trainings throughout the year, but this is the one that's kind of consistent and year long. So we'll also do trainings on, narrative therapy and DBT, art therapy, play therapy, those sorts of things. We this year have been really lucky and had a really amazing grant. So all of our interns this year are getting actually paid about $20 an hour for their work. That grant will end at the end of the year. However, we just applied for another one that I feel really, really confident about. If we get it, that will end up in a $25,000 stipend for next year's trainees. So really hopeful about that. If by some small chance we don't receive it, our stipends are $1,300. So the big difference there, but we're doing our best to help our folks not have to, hold another job while they're doing school and practicum. It's a really unreasonable year. So trying to get that going. We're looking for about 13 interns for next year. The good part of that is there's a lot of support. There's always a team that you're working with. And so, if a supervisor doesn't answer right away, which we almost always do very quickly, you can ask each other questions as well. So you're not working in a silo by yourself. There's a lot of a team spirit going on over here. We're also highly looking for folks who speak Spanish or Tagalog. Our Spanish-speaking clinicians actually participate in a monthly consultation group that they all have been really excited to do. It gives you the opportunity, if you do speak Spanish, to practice your clinical language in Spanish, because that's a whole other ball game, right? The clinical words aren't always easy to find. And it gives you a community to discuss, whatever countertransference might come up. It's another experience to work with a highly traumatized newcomer population. And so lots of things come up that are very specific to working with this group. What else is special about us? So many things. We are hybrid. So there's some potential to provide Zoom sessions. Of course, when you're placed in the school, it's in person. But one of the things we really try to do is meet our clients figuratively and literally where they are, right? So that we can increase access to care. The population we serve is deemed severe mental illness. So, when I was talking about this being a challenging experience where you learn a lot, that is part of it. Our clients come with, complex trauma, severe depression, sometimes anxiety, history of abuse, those sorts of things. So it's not going to be your test anxiety, sort of just want to talk to someone clients. These clients come with a lot of pain. And so, if you apply to come to our program, you have to kind of accept that you're ready for a challenging experience, understand that you're going to get family systems along with other theories, because that is our kind of perspective, that we are going to be working and engaging our clients' families. And I think I have said most of it. I definitely welcome questions. I'm going to throw our practicum flyer in the chat for anyone who's interested. To apply. Oh, sorry, one more thing. This is important. If we receive the grant and you want the $25,000 stipend, the requirement is that you stay on for 12 months. That's the requirement of the grantor. So you would have to work through the summer. So that's, something to consider about your schedule. If that's something you're not interested or able to do, but you still want to join us, you would still get the $1,300 stipend and such. We are going to start interviews next month. And we are going to accept people on a rolling basis until we fill up. We typically fill up around March. So I do encourage you to apply soon. And we'll have you over for an interview. And to apply, we just need a cover letter and resume and contact information for 3 references. We don't require letters of reference. If you really want to submit them, you're welcome. Any questions?
Thank you so much, Anya, and for your long history supporting our students. This goes back, so really grateful for everything you've done over the years, and thank you for that comprehensive overview and to hear about the funding our students. That's just terrific news. So anybody have questions for Anya about Daly City Youth? Okay. Well, thank you again, Anya, for sharing. And I'm happy. It looks like we have Michelle, Eddie, welcome. Nancy, welcome. Ling, welcome. Am I missing anybody? Evelyn, anyone want to jump in next?
I could go since I go after Anya since we're actually part of the same school district. Good afternoon, everyone. My name is Dr. Michelle Fortunado-Kewin. I am the counselor on special assignment here at Jefferson Union High School District. Shout out to Anya. We partner with her. Daly City Youth Health Center is part of JUHSD. So we work closely, collaboratively with them and their interns and trainees. Actually just bumped into one of your staff because I accidentally took her room. Shout out also to Eddie and Ling because I used to work for SFDPH. Just always wanted to give the love to the people that I know here, and there's a lot of amazing sites. Yeah, so Jefferson Union High School District, it's a high school district. We have 5 high schools and 2 adult programs. And we take about 10 interns and trainees per year. We mainly work on the high schools. We have 2 high schools in Pacifica, one that I'm in right now where the sun is shining. I'm at Terra Nova High School, and then 2 Daly City comprehensive high schools, Jefferson and Westmore, and then we have an alternative school, Thornton, which is located in Daly City. And this year we actually have a trainee specifically from SF State that is in our adult ed program. So they're supporting our students who are in adult education, meaning this is anyone from 18 and up who is going for their GED, ELL classes, ceramics classes. And we also have an adult transition program. So students who are in special education and want to continue schooling after high school. There's a program that helps support them as they transition in terms of becoming adults, but also still getting some education as well. So a lot of our work is, I mean, your traineeship will be in the schools. Primarily, you'll be at one site, whether it's one of the 5 high schools or in our adult program. If you are interested in, if some of you are doing some of the school counseling PPS, we could support that as well, whether it's at our high schools or our feeder schools as well. A lot of the work you'll be doing is really individual counseling, crisis counseling, groups, if that's something you're interested in. We have like open groups, closed groups, lunchtime groups. The beauty of working in schools is you get to see students in their environment, in their day-to-day. You could do a lot of drop-in support with them, a lot of collaboration with faculty, staff. Each school site has a wellness team of a wellness counselor, a school social worker, an ERMS therapist, which provides counseling to our students who have special education written or have counseling written into their special education. I'm the primary supervisor for most interns and then interns and trainees. And then we have also some of our sites are able to, site supervisors are able to provide supervision. I think with schools, I mean, there's so many fun things about it. Again, like one of our trainees was able to participate in the rallies and see students in those environments and able to do like push it into the classroom, helping students who with some of their skills and needs, collaborating and sending referrals over to Daly City Youth Health Center or other organizations. Some of our trainees are able to do home visits for students with attendance issues. You see a range of issues from breakups to self-harm to suicidality and anxiety. There's our district, because we're like a little tiny baby district, we don't have a lot of trainees in-house, but we have trainees that are offered from the county, or we try to bring people in as well to do some of this work. What we're really looking for are folks who are flexible, who are can work independently, and then also know how to seek out support. You know, pleased to say this year, a lot of our trainees you know, come from diverse backgrounds, whether it's race, ethnicity, and language. We do have a little baby stipend, 1,000 to 2,000. We're hoping to double it in the next year or so. Just trying to look in terms of more funding. Yeah, I feel like I mean, I'm a product of this district, so I graduated from this school district, so it means a lot to me to be here. And then just to give you a little brief overview of our adult education program is still new in terms of wellness services, but a lot of the work you can do really with them as well is doing short-term therapy, providing a lot of case management and clinical support with our adult programs. So if you're interested in working with the younger ones, like in the high schoolers, and then also get experience working with adults, that's what you can be open to as well. Again, we're in Daly City and Pacifica, so you're not having hopefully to drive around so much. All of our placements are in person, but sometimes our trainings and our meetings can be virtual. And yeah, our interview process will start next month, but it's really resume, references, and then we'll send you a questionnaire to complete.
Thank you so much for the overview and for all your work with our students. I know you have students there now and in the past, so again, big thank you. Anyone have any questions for Dr. Fortunado-Kewin? Okay. Well, thank you again for sharing about the sites. I'm sure you'll have some applications. I'll open it up. Would anyone else like to jump in? I
Sure.
know. Yep, go ahead.
I'm not sure who you were talking to, Julie. Was it me?
Oh yeah, go ahead.
Okay, great. Hi, everybody. I'm sorry to join late. My name is Nancy. I'm the Director of Behavioral Health at La Clínica de la Raza. My desk is in Oakland, but La Clínica is in Solano County, Alameda County, and Contra Costa County. So depending on where you all live, we might have a setting that is closer to your home than this Fruitvale headquarters. We're known for our Fruitvale site. We have 5 clinics in Oakland, in addition to 5 primary care clinics. And we also have 2 specialty mental health programs, one in Alameda County and one in Contra Costa. So what I'd like to do is describe our mission and then all of the different kinds of training that you would be able to receive here, and then a little bit about the process. So La Clínica is a federally qualified health center, and that means that we are here to reduce health disparities and to bridge the gap and to remove barriers to care. Our main mission is in that space of the social determinants of health. So most of our clinicians are bilingual, most are bicultural, and many of the environments are monolingual environments. That is not all of our environments. So if we have some English only speakers on the call, we definitely have excellent learning opportunities. So it really depends on what you're looking for and what kind of setting and experience would best serve your learning needs. So I mentioned our mission. You'll hear it and see it manifest in so much of the operations here. The first one that I want to call out is the La Clínica Behavioral Health Training Center. We really believe that we are the experts in culturally responsive care, and that it is our job to inform culturally responsive behavioral health workforce. We have a psychiatric residency, we have a master's program, we've got a psychology program for doctoral level students, and masters, both MSW and MFT, and we also have bachelor's level internships. And our direct service staff interact and integrate students throughout the year. So our trainees really very much become part of our care team. In the medical clinics, we have a program called Integrated Behavioral Health. Many of you are likely familiar. And in this context, integrated means bringing the whole person, behavioral health lens and care assessment across the continuum of care into the medical setting, which is where patients have a positive transference, where there's already trust, and we're building on the relationships that already exist. We have a large integrated behavioral health program in addition to our 2 outpatient mental health programs that I referenced. Our 4th program at La Clínica is a stigma reduction program using traditional healing and serving the community, bringing members of the community together for prevention workshops. And my colleague Evelyn, also on the call today, is particularly familiar with that space if anybody has any questions. So in terms of our training, we are providing culturally responsive evidence-based training. Really what that looks like is we are making adaptations. We're using case examples. We're using stories and dichos and cuentos for patients, so that the care is not designed by necessarily clinicians who aren't from the communities we serve. And there's a lot of relationship at the center. Our work is using a harm reduction framework, a trauma-informed framework, and the modalities that we are using are really quite extensive. Many of the modalities that my colleagues have already named. So we're looking at motivational interviewing and narrative therapy, and ACT and dialectical behavioral therapy, CBT, trauma-informed CBT, and these modalities are more or less prevalent depending on the individual settings. Let's see, in addition to having an individual supervisor. We have a weekly didactic program. Some of the settings offer a formal case consultation. Other settings offer trainings in their staff meetings. We have an intern program, which is roughly around 8 to 10 master's level interns, in addition to the other professions that I mentioned. I didn't share also that we have a psychiatric nurse practitioner program, and they work alongside our prescribing team in one of our specialty mental health programs. Let's see, the process, very, very similar to what's been described. Send us an email. Evelyn, if I can trouble you to put our portal or email address in the chat, that would be very helpful. And we will start looking at resumes as soon as we receive them. Our formal process will start in January. Our stipends, we've always provided a stipend. Last year, we increased our stipends for second years to, I think, 16,000. We're hoping to increase it for next year. We very much believe that we need to walk the talk. If we are driven by the value of equity, then we need to make our programs accessible to the students who we hope to hire after your training. And so therefore, we want you to come to us. We want to train you as our partners. And we have a wonderful track record for hiring from within our trainee cohort. And that was quite a lot. There's so much more to say. Thank you, Evelyn. And now I'd love to more formally introduce you to my colleague, Evelyn, who is actually our new internship and recruitment coordinator. And I'm hoping that that will illustrate that this, our training and the quality of our training and the experience of our trainees and interns is a top priority for us. Evelyn's our point person, and we'll be able to shepherd you to the right programs. Evelyn, thank you. Turning things over to you.
Hi everyone, I apologize. I'm having some technical difficulties, so I won't be able to have my camera on, but it's a pleasure to meet you all. My name is Evelyn Riley. I am the Behavioral Health Internship and Recruitment Coordinator here at Clínica. My job is to manage and coordinate outreach, recruitment, and onboarding of our behavioral health interns into all of our internship opportunities that Nancy has outlined. We have a variety of different sites, and we do have internships at all different levels. Happy to be here, really looking forward to assisting you all on this journey. I will also be putting my direct email in the chat, so throughout this application process, if you have any questions, any hesitancy, or just need a little bit more information about any of our different sites, trying to navigate all that, feel free to shoot me an email, happy to respond.
Evelyn, sorry to interrupt. Thank you so much for that. Just a clarifying question. My memory is foggy. Is our email here internships@laclinica.org or internship?
It's internships.
Okay.
I apologize. There's a typo in there. Yeah, it should be plural. I'll resend it.
I got it right now.
Thank you so much for that, Nancy and Evelyn. I really appreciated. I mean, I know we've worked with La Clínica for a while, but I really appreciated that comprehensive overview. I know La Clínica is quite a large organization and offers so many options. So I really appreciated that overview. And also, again, it's really nice to hear how hard everyone's working to give trainees stipends. It's just amazing information. So anyone have any question about La Clínica? Who's here? Any students left? I do have one question. What if you are not a Spanish speaking intern, do you suggest this might not be the right place, or are there certain sites that are more likely to work?
Thank you so much for that question. Absolutely. You know, we're large. So where we find that English only interns and staff are the most comfortable and completely successful and are not in any way unusual, and will not suffer in any way in terms of quality of learning and experience are in our school-based health centers and in Solano County. Now, that said, there are likely other possibilities for English speakers within Alameda County and within Contra Costa County, but it depends on the timing and whether the supervisors are available in that year. So definitely if we have non-Spanish speakers, you can have an excellent learning opportunity with us. And we have staff who are English speaking only. So certainly reach out. It's an important thing to know what your preferences are. And we're happy to work with you.
Thank you so much. Really appreciate you being here. Sounds like Evelyn, welcome to your new position. So I want to open it up. I also just want to acknowledge, let's see, I think someone else, just Heather Graham just might have popped on too. So I know some of you have been on for a while. Anyone like to go next?
Sure, I can go for.
Great.
My name's Eddie Powers. I'm here with my colleague Ling Busche. We're from San Francisco Unified School District. So we'll sort of tag team this. I'll go first. I'm from the student intervention team, which is our clinical mental health training program. We usually take 40 or 50 interns or trainees from about 14 different universities. We'll put them at 45 or 50 school sites throughout San Francisco. So we're large district, and we'll have interns and trainees sort of at all levels from pre-K all the way through high school. So similar to a lot of the things from the other school-based sites, they shared a lot of some of the internship activities. We'll be providing sort of individual or group counseling services for students, a lot of family outreach and engagement. We'll have a lot of opportunities in terms of doing assessments and observations in the classroom, and some drop-in supports at the wellness centers. We have wellness centers that are in our high schools, middle schools, and some of our elementary school sites as well. In terms of, the big piece in terms of school-based work and a big focus of our training is on providing sort of trauma-informed teacher and staff consultation, right? So learning how to really support your students that you're working with by sort of strengthening and supporting their sort of like caregiving network within the school. So there's a lot of opportunities to be part of the wellness team on site. You'll be working under the school social worker who's at each school, and you'll be able to participate in a lot of the multidisciplinary teams that provide services for the identified student. We have a couple sort of specialized placements or focal placements that work with specific populations. One of the partnerships we have now is with the UCSF Hearts program at a couple of our school sites, where you'll receive specialized training in some trauma-informed services within those schools, and working with the team from UCSF. We have a placement with our Early Ed Shoestrings program, which is a program that's focused on sort of our youngest students, sort of with in an effort to sort of keep sort of address the disproportionality of sort of Black and Brown students in special education. So a sort of a specialized program to support very young students with behavioral needs, as well as a specialized placement with our LGBTQ support services team. We, just in terms of training and support, just have weekly individual supervision with a clinical supervisor. We have two hours of group supervision every week, and sort of a range of trainings throughout the year. So we generally have maybe 2 to 3 trainings a month on a variety of topics. Let's see. Anything else? Ling, I might turn it over to you.
I can't think of anything else, Eddie. I thought that was a pretty good overview.
Yeah, this is an IEP
Should I go ahead and go, or if you think of anything, Eddie, chime in at any time.
Perfect. Yeah, why don't you go ahead, Ling?
Okay. Hi, everybody. My name is Ling Busche, and I'm a lead counselor with Student Family Services Division, and I support the school counseling internship program. And really grateful to have a collaboration with the student intervention team. But our program is a little different in that we place specifically with school counselors, and we have placements. It vacillates a little bit year to year, but typically K-8, middle school, high school, and we also place at our alternative education sites. So there's a great opportunity to experience school counseling. You know, our schools are so diverse and unique, and so there's lots of opportunity to kind of explore sites, because we focus on making sure that there's a good fit for the trainee and also like for the site and the supervisor, which means in the placement process, we try to have our candidates explore a few different sites to see if it's a good match for them, and kind of like vice versa. Let's see what else. Typically, we have about 30 to 35 placements every year. And similar to the student intervention team, we start kind of like our screening process in the spring. I think there's like a little difference in the way that we place, like Eddie places all year round. Is that correct? And we will place like mid-year, but that's kind of more of an anomaly. We do our screening process in the spring. Candidates are able to kind of like check out sites, and it's a site that should be a good fit, and also like the supervisor, right? Like just to make sure that there's a good sort of energy and compatibility across. But we do kind of like confirm those placements in the spring, and then the placements occur for the duration of the following school year. And we do ask that our candidates make the commitment for the full year. And, you know, as a school counselor, you work like across 3 main domains: so academic counseling, social emotional, and college and career. And we try to follow the ASCA model, so multi-tier, multi-domain system of support, which looks different, obviously, across schools. And middle school versus high school, you might be more inclined to do the academic work. But I think across all levels, there's opportunities to engage in all 3 domains. And in my experience, our candidates are able to work on a collaborative team. So, you know, you might have one site supervisor, but you're working with the entire support team. So I think that's really a nice opportunity to kind of understand the relationship between roles. We're really lucky because we get to piggyback on a lot of the amazing optional workshops that the student intervention team provides. And there's a great orientation at the beginning of the year that covers sort of like what it's like to be an intern in SFUSD. And we cover protocols, and also, you know, we just try to create a space that is like a community of our school-based interns. And so we have that, and our school counseling interns are usually welcome and invited to all of the professional development that's available to our school counselors too. Yeah, and if anybody has any questions, you know, or any questions at all, you know, feel free to email me, and the process and the steps for our screening process will be available probably in February, but typically it's April and May that we do our informational meetings, and it's a time when candidates explore sites and we kind of like prepare for placement. So yeah, that's about it.
Thank you so much, both of you. Appreciate you both being here. And again, also a big thanks. You've been training our students for many years, and we're grateful for that and for this overview, and especially how the two differ in some ways. I think that's important to know. And I got the information off the chat about who to get in touch with. So, and I think we have all your information. So any questions here for Ling or Eddie? No? Okay. Okay, who's left? I know Heather is here. Katie might be here, I think. Am I missing anyone?
Hi, this is Katie from PP NorCal. We're currently not collaborating with a SFSU student right now, but we have had students previously. And for folks who are not aware, Planned Parenthood of Northern California is a mild to moderate mental health provider. And students can meet with patients for warm handoffs while they're here for their clinic visit. And then for ongoing therapy, kind of a traditional counseling model on a sliding scale fee.
Okay, thank you for that. And it sounds like then, I mean, we can talk offline, but I know we haven't had a student with you for a while. And so it sounds like you may be interested in working with us this year.
Yeah, we are. We had to pause our program during COVID for a myriad of different challenging reasons, but we do have students right now through St. Mary's. We have 4 students that are with us this year.
Okay, great. Okay, well, we'll connect with you also offline to get things rolling and see if we have students who are interested. But I appreciate you being here and checking in with us, because it would be nice to have our students at Planned Parenthood as well.
Great.
Yeah, thank you so much. Okay, Heather, would you like to talk about OUSD?
Sure. Hi, everyone. Thanks for having me here. My name is Heather Graham, and I'm from Oakland Unified School District's Behavioral Health Internship Training Program. I see one of our lovely interns in the mix right now. Hi, Lana. So we're a big program, pretty similar to SFUSD. We take about 22 to 24 interns and trainees every year. We are mostly focused on the MFT counseling side of things, but we have a collaboration with our school counselor program as well. So those are options. We are focused mostly on elementary and middle schools for our internships, and we have sites that we've had interns and trainees at for a really long time, really lasting relationships with those site partners, really robust training. We have a partnership with Fred Finch Youth Center to bring in professionals doing the work in the field to come train for us. And along with that, many of you may know that OUSD started restorative practices. We have a big focus on equity, so you have access to a lot of expertise on school climate. That's my child, speaking of school climate. Expertise on both looking at the school system and interventions that are important for kids and families, and also intervening on a clinical and academic level with students directly. We do the duration of the school year. So our field placement starts in August with 2-day orientation. And I think something that is really unique to us is we work really hard to build community amongst our trainees and our interns. So you're not the sole intern out there trying to learn on your own. There's a lot of handholding and support from supervisors, but also intern to intern. So we really try to bolster that community of learners. And so we meet weekly for group supervision and individual supervision and or trainings and community gatherings. There's a stipend at the end of the year. Right now it's $1,000, but we're hoping to increase that. We, as the most diverse district in California, languages that folks can utilize to better serve our kids and families are really important to us. So we're hoping to offer a little bit of a higher stipend for folks who are bilingual, bicultural. And there's also an opportunity to work in LGBTQ programming. So we have a new partnership this year that's really exciting, specifically serving kids who identify as gender nonconforming, non-binary, or LGBTQ. So that's in partnership with our staffing and liaison in LGBTQ programming. Just really fun place to work. Lots of good, exciting things happening. And we love bringing in folks, especially dual folks who are doing MFT and school counseling, because I think that really there's a lot of great learning opportunities in our district for those folks and for us to learn from you also. Is that everything? I think that's everything. Oh, I guess I should put my email in the chat. That's the best way to schedule an interview. We just do rolling acceptance, and like other folks have said, really try to do a good match around supervision and site needs and fit. And so I'm going to put my email in the chat, and then I'll also put the email for the school counseling program lead for folks who are only focused on the school counseling piece so that you can reach out to that person. Any questions or things I didn't cover?
Thank you so much, Heather. And once again, thank you for all the training you're doing with our students and continuing to partner with us. And really appreciate everyone being here. I know that we don't have that many students here, but please know this is going to be disseminated far and wide. And I have to just say, I've learned a great deal. I've really appreciated this. And I also just want to put an invite out that for our training, our integrated behavioral health training project, we are looking to develop an advisory group around integrated care and training our counseling students. So if it is something, I will be reaching out. If it is something that you might consider, not a lot of time, I'd be grateful for your input. And I will be reaching out about that. I don't think, have I missed anybody, any partner providers? No. Okay. Well, wow, 3:32, we are on the dot. So again, I just want to thank everyone, Anya, Nancy, Heather, Evelyn, Katie, and students for being here. And we look forward to continuing to work together. And don't hesitate, anyone, to reach out to me, students, if you have more questions. And also partners, if you have more specific information you'd like me to disseminate to students or post on our project website, we're trying to make it as accessible as possible so students know exactly who to contact, how to do it, when the dates are. So anything that you want around that, please do send it to me.